you are basically known as the UBI guy. When we think Andrew Yang, we think about universal basic income, and I do want to talk to you about that. However, I actually want to start with some different policy positions that we haven't necessarily heard as much from you on. So the first one is, when you go to your website, there are three key policy planks. So the first one, of course, is UBI. The second is Medicare for All, and the other is human-centered capitalism, which I guess is more of a philosophy, but I still think that that's pretty helpful because it kind of gives us a sense of what you believe in. Now, going to Medicare for All, when I click on Medicare for All, what you seem to be describing is more of a public option. And at the CNN town hall you did, somebody asked you about healthcare, and you said that you're firmly in the camp of Medicare for All / public option. But my question to you is, these are two very different programs. So which one is it? Which do you actually want to implement as president?
In my book, it's like I was a little bit ambiguous in terms of those two things as well. But I've come to believe that that a public option would be better, and also would enable a better transition. And the goal is to make it, frankly, such that most private insurance has no place in the market, and that you get rid of it. With the save for perhaps a few super gold-plated concierge things that might not be a bad thing for the American people, because if some really rich people are spending lots of money on esoteric treatments, then we can benefit from that research and the money. So at this point, the plan that I saw that I've now gotten on board with has been bringing down the Medicare eligibility age over time as a phased rollout, and then make it so that all Americans become eligible for that, try and get the prices down and the access up, and then essentially squeeze out the private insurers out of the marketplace and demonstrate, because most consumers, if you tell me, hey, I've got this low cost quality public option, I'm going to embrace that. I'm going to jump on that. And you can make that happen, I think, much more expediently than if you were to make private insurance illegal.
So you actually do want to make public insurance illegal. That's the long-term goal.
I want to make it so that private insurance is irrelevant for 95% plus of Americans, that we're all perfectly happy showing up to our medical healthcare provider and saying, hey, I'm Andrew, I'm here, I've got the plan everyone has.
Right.
And my parents actually have experienced this. They were blown away. My parents are immigrants from Taiwan, and they've been living in Taiwan for the last number of years. And they've been blown away by the disparities between that healthcare system, where they just show up, they get what they need done, they pay $20 out of pocket, and then they go home and are like, that was it? Like, I didn't have any crazy forms or like third party, and then none of that. And they come back to the U.S., and then all of a sudden it's back into the maze, the high cost maze.
Right. Okay, so let me ask you this. Since your goal is to make private health insurance companies irrelevant, even though it's obvious that if you do have a public option, they'd be forced to compete, and a lot of people would probably opt for the government-run plan because it would be more cost-efficient, it would provide more robust benefits. But if your goal ultimately is to do away with private insurance companies, why not just go the extra step and opt for Medicare for All, especially if you become president? Because this is what I'm visualizing. Let's say President Andrew Yang is proposing a new healthcare reform policy. If you start with public option, Republicans are going to negotiate you down from that initial position. So if your goal actually is public option, why not start with strength and say, we're going to do Medicare for All, and then if you get negotiated down to a public option, then you still come out on top. Why not opt for the more robust, comprehensive plan? Because the real key difference here is Medicare for All would make healthcare free at the point of service. And if you want to actually do away with private insurance companies, there's no better way to do that really than just implementing Medicare for All full stop. So why not?
With private companies.
Exactly. So why not do that full stop?
I like your negotiating approach.
I'm very much a purist on Medicare for All.
I think anchoring them high is a very good first step. If you said right now, hey, Andrew, your choice is Medicare for All, single payer, get rid of private insurance, or our current plan, I would say we should definitely go to single payer like yesterday. The question really is what the path and what the transition looks like. And I think that the transition would be marginally better if we weren't putting all these private insurance companies out of business on the same day.
Well, to be clear, the Medicare for All proposals in the House and Senate, they actually have a 4-year transition period. The Senate version has 4 years, and the House version has 2 years. So it wouldn't necessarily be an overnight transition, just to be
or even phased out. I mean, but they'd still theoretically all go out of business on the same day 4 years from now. and so I'm not against your suggestion. Like, I think philosophically, you and I are aligned on the goal and the vision. I mean, the vision is in the richest, most advanced economy in the world. Why are we all going broke on our health care? Right. Why are these prices so ridiculous and opaque? Why are we more stressed out if we get sick or injured about paying for treatment than we are actually getting well or caring for our loved ones? And I'm for any path that gets us there. If I believe that we can make single payer happen and that transition is superior, I'd be happy to start with that.
Well, and let me just make one last pitch for Medicare for All to you, not to beat a dead horse. But currently, Medicare for All is polling at 70+% among the general population, over 80% among Democrats, and 51% among Republicans. Now, when you poll them on a public option, it still is popular, but currently, Medicare for All has name recognition, and I think this is why you're seeing other presidential candidates. They're taking a public option, and they're attaching that Medicare name for it. So, for example, Pete Buttigieg has Medicare for All Who Want It. Beto O'Rourke has Medicare for America, and you have Medicare for All. So I think that there is that popularity that you can sell to the American public. So that's just one last thing that I'll say. So let me tell you this. As a Medicare for All purist, I hope that I will see a President Yang push relentlessly for Medicare for All, because if you really want to do away with the health insurance companies, there's no better way to do that than Medicare for All.